we are so grateful, Dr. Sanchez, for your expertise and for sharing your time with us so generously. And thank you. I'm sure we're all applauding you here in New Zealand. We look forward to potentially having you come here sometime and host.
I'd love to. And if anyone, and I know you mentioned that if anyone wants to come to Columbus, I'm more than welcome. You're all more than welcome. But thank you, Holly, for inviting me. It's great. Move forward.
Yes, thank you.
Done. Okay. Take care.
Okay. We are going to continue on with our next speaker. We don't have a break here. We're just going to make the best use of our time. So I'd like to introduce our next speaker, Angela Fraser, or I'm sorry, I don't know where I got that. Veronica Fraser is an advisor on deaf children in New Zealand in the Rotorua and Tarangi region. She's part of the Ministry of Education Learning Support Team, and she works with families of children who are newly diagnosed with hearing loss through to year 4 at school. And then prior to being a advisor, Veronica was a resource teacher employed by Kotakareo for 16 years, working with children from age 4.5 into the late teens. So Veronica brings a unique perspective based on her experiences with children and families. And her presentation today is entitled Asymptomatic cCMV and Personal Stories of Professional Inquiry. So thank you, Veronica. I'll invite you to share your screen now.
Can you see my screen?
There we go. Got it.
Oh.
And if you would, you can put it, do you know, in slideshow form?
Yep, you've got it there now.
Perfect. Thank you so much.
I'm sorry about that.
All right.
Okay, as Holly said, I'm an advisor on deaf children based in the Rotorua area. Previous to this, I was a resource teacher of deaf for about 16 years. So about 15 years ago, I was working as a resource teacher of deaf, and I picked up a 4.5-year-old student at kindy. He was profoundly deaf, he had a cochlear implant, and the cause of the hearing loss was congenital cytomegalovirus, which at the time, apart from the hearing loss link, we knew very, very little about. So her whānau were really on board. She seemed to be developing oral language relatively normally. But at 4.5, there were starting to be a few niggly concerns. So she transitioned to school. Language processing skills were a little bit delayed. Her skills in spoken language didn't really translate into literacy, as you might think they would. She developed quite big emotional and behavioural issues. She had difficulty making friends. Her parents reported she didn't sleep, and she had very mild mini seizures. No one really understood why. Since then, I've had other students who have had congenital cytomegalovirus as a cause for their hearing loss. There's not a lot of information about it, particularly in its asymptomatic form. And I've always wondered just how much of an influence cCMV has played on these students' lives. So this year, as part of my master's required for to be an AODC, I had to do some research. So it seemed to be the opportunity to honour the memory of that particular student and find out a bit more about what asymptomatic cCMV looks like for children and their whānau.
Veronica, oh, okay, I didn't know if your slides were advancing. They are now. Thank you.
So to date, we know little about the experiences of whānau in New Zealand who have personally experienced asymptomatic cCMV, particularly in terms of what this condition looks like for the child concerned and what support there is for whānau. So my goal was by the gathering of stories parents tell of their journey with asymptomatic cCMV. It's the first step in understanding this disease and has potential to ultimately improve knowledge, awareness, understanding, and support for whānau in terms of its hidden elements and the effect it has on children's lives. Before I start, I'd just like to sincerely thank the families that so generously shared their stories. The names of the children in this list are all pseudonyms, and for further privacy, I've taken out the regions in which they live. But I interviewed just 5 families. I interviewed the mums, either online or face-to-face. The children were all second born in their families and aged in range from 7.5 through to 10. They all live in the Waikato and Bay of Plenty region. 4 of the 5 children were identified with hearing loss as a result of universal newborn hearing screening, and the cause of their hearing loss was congenital cytomegalovirus. The 5th child, he had severe reflux and colic. His mother reported that by the evening of the first day that he was born, he started screaming and basically screamed nonstop for about 9.5 months. In trying to establish the cause of this, the only test that came back positive was cCMV. This child was later found to have a hearing loss as well. So 2 children have profound bilateral hearing losses. They both have cochlear implants. 2 children have profound unilateral hearing losses. One has a cochlear implant and one has hearing aids. And 1 child has a moderate loss. She's got hearing aids. 2 of the children have had progressive deterioration of their hearing. And so this is a trait of cCMV. And it's a trait that continues through until adolescence. As you can imagine, each individual story is unique, but throughout the stories, similar themes emerged. Why is it not moving?
Just click on your screen and then try advancing on your keyboard again.
So the first theme was the lack of awareness of cCMV prior to the diagnosis. Parents reported it was like, what is this? Where does it come from? How's it going to affect his life? Congenital cytomegalovirus, why have I never heard of it? 4 of the 5 mums reported normal pregnancies. 2 reported having flu-like symptoms in the final trimester. And 1 remembered having flu-like symptoms throughout most of the pregnancy. 1 wasn't sick at all, but with a 2-year-old at daycare, she was aware there were a lot of normal childhood bugs in the household. And the 5th mum, she vomited all day, every day of her pregnancy, but had done that with a previous pregnancy as well, so it appeared not to be cCMV related. But despite those flu-like symptoms, no doctor or midwife mentioned CMV or cCMV to the families. So for them, it was like a bolt out of the blue. There was a difficulty in obtaining the diagnosis of cCMV. At birth, all the babies looked fine. But by the end of the first day, 1 baby had developed hypoglycemia and had a rash. She was put on a breathing machine. She was eventually diagnosed with an incredibly rare blood disease contracted because of a genetic incompatibility between her parents. There was no test for that condition, but doctors told the family that there was no doubt in their minds that this is what the baby had. That particular diagnosis had a huge impact on the family, and because of it, they decided they'd have no more children. This child was later diagnosed with a mild hearing loss, which then progressed to a profound loss. So at that point, the family decided to have for the baby to have a cochlear implant. At this point, the Guthrie card, the heel prick, was checked and cCMV was diagnosed. So practitioners at the Hearing House later commented that this child's birth story was a classic example of a cCMV birth. This mum commented that cCMV wrapped it all up in a little bow. He figured, how could a child have so many unrelated things happen? The breathing machine, the blood condition, the hearing loss, then the progressive nature of the hearing loss. cCMV connected it all, wrapped everything in a neat little package that made sense for them. For other families, it was the local doctors not knowing about the condition that made it difficult to even get the test done. So the hearing house surgeon told the family to put a cotton wool ball in the baby's nappy, then put it in a plastic bag and take it to the GP and ask the GP to test it for cCMV. The GP had never heard of cCMV, so she rang the cochlear implant surgeon and he explained it. A proper urine test was then done, then came back that the baby had cytomegalovirus. They then went back to the heel prick on the card and it came back positive for cCMV. Hearing House was the one organisation that did start to know a little bit about cCMV when these babies were born and as they progressed, and all the families who were involved with the Hearing House are particularly appreciative of the knowledge that they had. All the whānau reported a lack of information and support around the diagnosis of asymptomatic cCMV. Parents reported, worst thing was there was just no one to ask. No one has any understanding of it. I'd not go to my GP, she didn't know anything about it. When the cochlear implant surgeon referred us to our local hospital for developmental checks, the paediatrician there said, asymptomatic. This is someone who's read something in a book and ticking boxes. None of this is necessary. So with the diagnosis, there came a sense of isolation and despair. Families turned to Google and Facebook, but there was little out there in terms of information, particularly around cCMV in its asymptomatic form. One mum said it was overwhelming. I was just, oh my gosh, why have I never heard of this? On Google, it said there could be all sorts of effects, brain damage, cerebral palsy. Physically, my child did not look like any of the babies that were shown. There was hearing loss. We didn't know what else there would be. So though my study is very small, the parents did come out with similar kinds of symptoms for the children. It's perhaps just a variation in the degree. The hearing loss is the obvious one, given that this was how the children were identified with cCMV. cCMV is the leading cause of non-genetic hearing loss. And when the cause of hearing loss is a result of cCMV, it can be progressive. So 2 of the children in the study went from initially having mild hearing losses to having profound. And as I said before, the progressive nature can continue until teens. So children identified with hearing loss due to cCMV are monitored very closely. But what is worrying is the children who pass universal newborn hearing screening, but later develop a hearing loss. How long is it until their loss is identified? Speech and language development varied amongst the children. So children who had cochlear implants, of course, had the support from the Hearing House habilitationists, and parents found that really helpful. Despite support, some children's speech and language development was slow. The parents of one child reported that at 5, she had 4 to 5 words that people other than family could understand. So as well as the Hearing House habilitationist, this family travelled from Hamilton to Auckland fortnightly for 4 years to work with a specialist speech language therapist. Now at 10 years old, her language is roughly age appropriate, but she doesn't understand things like sarcasm. Other families report that their child's speech developed, but transferring this knowledge to literacy at school became an issue for their child. The 3 of the 5 children experienced difficulties at school. 2 have ongoing resource scheme funding. 3 have resource teacher of the deaf support. But again, parents found that teachers at school don't have any understanding of cCMV and its complications. One parent said, his teachers don't know anything about it. They have no idea until I tell them. Everyone I tell is just astounded. No one has heard of it. I think a future study could be looking at how well these children perhaps do at school. Be valuable. Sensory issues. One child can't tolerate clothing around his neck. Doing up buttons is an issue. He likes firm pressure and wore compression clothing for a while. He did well with a weighted blanket. Another child can't tolerate the tags on clothing. Parents talked about their children not being able to tolerate an overload of sounds or being overwhelmed by crowds or lots of noise. A couple of whānau talked about their children shutting down in very noisy, busy situations. Like if we go to a movie, for example, she will fall asleep. She would not do that at home. I think the volume in the theatre gets too much. It's almost like she shuts down. Even the movie Frozen II, which she was so excited to see, we got to the 45-minute mark and she was just out to it. One mother reported her child said that her brain just felt really, really busy all of the time. Another child can't tolerate the Roger microphone system being used in a noisy environment, whereas other children who don't have the cCMV can. Some children have emotional and behavioural issues, maybe as a result of that sense of being overwhelmed. Parents reported their children lashing out, being defiant, self-harm, agitation, kind of thing. Some children have severe anxiety issues. So one mum commented how heartbreaking it was that because of this extreme anxiety, her child missed out on the things that she enjoyed the most. Behaviour for a number of children is reported to be perfectly fine at school, but they lose it when they get home. Others display social issues, not good at turn taking, sharing, winning and losing. Some mums report that the children don't have real friends at school or have a tendency to play with younger children. A lot of the children had eating issues, but the parents reported that their cCMV child's issues with food were a lot worse than fussy siblings. So the children with cCMV were much more determined. One mum reported that her older daughter is fussy too, but they can eventually get her to eat. She won't go hungry. Whereas the cCMV child will starve, once going 24 hours without eating before her mother eventually gave up. Another child doesn't like food that involves chewing. His mother wonders if that's linked to that overload in the brain. Sleeping was an issue for children. For some, it was when they were preschoolers. It was an endless cycle. I could be putting her back to bed 30 or 40 times a night until eventually it might be 3 o'clock or even later that she would fall asleep. Or between 18 months and 5 years old, he would wake in the night and shout, random shouts for a long time. I would go in and try to settle him. He was not distressed or upset. He would just be talking to himself. He used to be awake for up to 2 hours just shouting, and nothing you could do would stop him. Other children, they might have slept fine as babies and toddlers, but then when they got to school, sleeping became an issue at that point. Physical development and vestibular disorders are also frequently linked with cCMV, but have not been shown to correlate with the severity of cCMV or with hearing loss, and they can also be progressive in nature. In the present study, 4 out of 5 children showed delays in meeting early physical milestones, so walking and crawling. 3 of the 5 children now have vestibular and balance dysfunction. One child has poor muscle tone and balance. For her, even simple things like bending over to put her shoes on is difficult. She needs to sit to get dressed in the morning. Another child also has poor balance. She would climb up something, maybe on the trampoline, and then fall backwards. So all the children play sport or they dance, but he runs kind of funny, says one mum. Or she loves netball, but she just looks a bit unco, says another mum. The research question in the study was how whānau relate their personal journey with a diagnosis of asymptomatic cCMV. Asymptomatic cCMV, just the name drives me nuts. The word asymptomatic itself carries so much weight. There's nothing asymptomatic about it. It was the first statement from my first participant. Her sentiment was repeated through all 5 journeys. Asymptomatic implies no symptoms, yet all 5 children have clear side effects ranging from hearing loss, language and learning issues, physical concerns, eating and sleeping disorders, through to emotional, social, behaviour problems. So this study has given me a better understanding of what asymptomatic cCMV looks like for families and children affected. I think there needs to be further research done, particularly in terms of the implications for children at school. So again, I'd like to sincerely thank all the families who shared their stories. Like the families, I hope that through this research, we can develop a better understanding of what a diagnosis of cCMV means and be able to give some support to the families who are affected.
Thank you, Veronica. Let's leave your contact information up there for just a minute. Well, think
all right.
Okay, that's all right. Thank you for sharing this. This is really impactful. We had some clinics at the Hearing House for children who had cochlear implants, and of course, so they were under our care for that reason. But one of the things that was so enlightening when we had these clinics is bringing the families together, and when the parents would see the common features in their child and other children with sensory issues and eating issues and some neuro issues that were undiagnosed at the time. And I think it really just reminds us that this is a disease that affects the brain. And while hearing loss may be the thing that first gets our attention, that the children often have many other symptoms and issues, and many of these could be addressed through early intervention. And of course, we all know that early intervention is the answer for many things, that the sooner we can identify and address them, the better outcomes we'll have. So is there anyone else who has comments or questions for Veronica? Well, thank you very much for sharing again, Veronica. We really appreciate it. All right, we'll move on here. We have one more presentation. That I'll be giving on behalf of my student, Pia Padayhag, recently completed her thesis on this topic, and she's currently an audiologist working at Bay Audiology in Rotorua, and she was unable to be present to do this presentation today, so I'm on her behalf happy to share this with you. She recently presented this at the New Zealand College of Midwives conference last month. So it was really a wonderful accomplishment for a new grad. Her other advisors for her thesis were Haruna, who's here today, and Peter, who I believe is also on the call. So we've heard a lot about CMV already. It is the most common congenital infection, affecting 0.3 to 0.7% of live births. In addition to being an important cause of hearing loss, it's an important cause of cerebral palsy and other neurologic impairment in children. The infected baby can present with a wide spectrum of symptoms, as we've just heard from Veronica. and 10% of those with symptomatic infection can include serious organ diseases, neuropathologies that manifest a sensorineural hearing loss, cerebral palsy, intellectual impairment, and visual disabilities. Therefore, management of these children requires a multidisciplinary approach to the variation in symptoms. In severe cases of cCMV, it can lead to miscarriage and stillbirth. The majority of the proportion of these infected babies are asymptomatic, as we have heard. But what does asymptomatic really mean? And they have a 6 to 25% risk of having an isolated sensorineural hearing loss that will present potentially later in life. So how do we prevent cCMV and its implications? Universal and targeted CMV screenings has been demonstrated to be cost-effective due to the improvements that could result in hearing and neurodevelopmental delays through early intervention. And universal screening is particularly beneficial for identifying asymptomatic infants who have the risk of presenting delayed symptoms. But due to the complexity and diversity of the CMV strain, formulating an effective vaccine remains a persistent challenge, as we've heard from Dr. Sanchez. A more accessible preventative method is the incorporation of hygiene practices and sharing information about that. So the most important or the most prevalent way that a pregnant individual contracts CMV is through direct or indirect contact with a body fluid. And children ages 1 to 3 years of age, particularly those at preschool, are the ones that may be shedding the virus most often and exposing new moms. So people are less familiar with cCMV compared to other congenital conditions due to the inadequate information that they have been supplied. We know that women who receive antenatal care, 64% of them in this one study were unfamiliar with cCMV compared to Listeria and toxoplasmosis, which have a much less prevalence among mothers. So we know that mothers are motivated to learn and want to adopt preventative measures, but they sometimes are just unaware of what information is out there. And healthcare providers really are the key source of information, providing information on cCMV to new moms and families. So this study that Pia has done was based on some of this rationale that there is a significant lack of knowledge on cCMV among healthcare providers. And in a previous study, it was shown that only 8.8% of New Zealand and Australian midwives, GPs, gynecologists, and obstetricians routinely discuss cCMV with pregnant patients and ways to minimize their risk. So for her thesis, Pia did a survey and did some focus groups with midwives, pediatric ENTs, and pediatric audiologists. And through these semi-structured interviews, she learned what people were sharing, what kind of information professionals were sharing with families, what their own knowledge was. And then she did a reflexive thematic analysis of the qualitative data. Her focus for this presentation is on the midwives and the information that they may know. So the first theme that was generated from the analysis of the themes was that knowledge drives progress. The more we know, the more we can do. So this was feedback and analysis from the midwives only. This theme demonstrated that the power of knowledge motivates people. And the theme was demonstrated when interviewees who are unfamiliar with cCMV showed a very positive attitude about learning more about it. Anything that we can do to affect the developing baby and have long-term effects is something that we actually have to be aware of and we have to protect against when possible. Other comments were, if we have limited understanding, how do we help our clients? We need a breadth of knowledge so that we can individualize the information to people. And then finally, it's about giving them the option to make those informed choices for themselves. So there was definitely a sense that once they knew more about cCMV, that they felt a responsibility of sharing that knowledge with the families that they serve. The next theme that came to surface was that it became clear that participants who had awareness and knowledge of cCMV had learned it through guidelines or protocols. And while those who lacked awareness and were more reliant on acquired knowledge through clinical practice. So having formal guidelines was one of the conclusions that these midwives came up with. The need to have formal guidelines, unless somebody has had an interest or perhaps looked after somebody who's had it, it would be the only way that a midwife would learn more about it. So they were really asking for more support for national guidelines that they could share with their Whanau. The third theme that Pia found was that that this United Against CMV, that multidisciplinary approach is really necessary. And so some of the questions or the responses that she derived were shown here. Getting health professionals on board to understand that we can actually be part of the solution. We need a support system. We need to have a link of where to go next and where to refer people for either more information or support. We need also to continue to work in other areas as feasible ways of screening infants and other techniques. So this sense of needing to work together, to be part of a team, was a strong theme among the midwives. Seeing the whole picture, a holistic patient-centered approach to health. This theme was developed from comments that suggested that there was a need to move away from an authoritarian dialogue and have a more open channel of communication with the moms. We don't want to say you shouldn't do that, but we need to provide you with this information. This is the safest way for you to do this. It also acknowledges that an individual is part of a collective culture and that having resources that are wide-reaching for the community are needed. The way that a mom interacts with her baby is how she has seen her mother or other older females do it. So having an approach which recognizes that is important. And then the last statement speaks to the fact that midwives appreciate that not all mothers have the support or resources that they need. And I think that, of course, as a group, they're very aware of the conditions that some mothers exist in when they're child rearing. The last thing that they need to worry about is this kind of hygiene when they're looking for somewhere to sleep for the night with 3 kids and they're sleeping in their cars. So this all really speaks to the fact that a really multi-pronged approach, multifaceted strategy to increase awareness is needed. So what can we do going forward? Pia and I have met with some of the instructors at the college about providing more information to midwives in their training. And through this, we've been collaborating with a group of CMV specialists in Australia. The cerebral palsy group there has developed an e-learning program that is designed for midwives. And so we shared this link at the conference and encouraged, it's a free link, it's a free program, and encouraged the midwives there to investigate it. But what we would really like to do is develop your e-learning program for midwives in Aotearoa. Part of what Pia discovered in her interviews and focus groups is that midwives in New Zealand serve about 96% of new mothers, and they come from very different training programs. Many of them are not trained in New Zealand, and a lot of their training happens on the job. And so continuous upskilling and professional development is really an important avenue for them to get new information and to share new information with their clientele. So this is the link to the Cerebral Palsy Alliance e-learning course. It is meant for midwives, but anyone can go on and take it. And I think that it's a useful link for educators, clinicians. Even though it has a midwife focus, there's a lot of good information that I think that we can share with our families about preventing infection. And as I said, we're hoping to develop a version of this for New Zealand. And if there's anyone out there, particularly midwives, who would like to work with us in modifying this, we'd love to hear from you. So her message, the message that Pia wanted to provide at the conference was that what you learned today, put in practice tomorrow. The more we know, the more we can do. Awareness and prevention are the keys to minimizing the risk of cCMV. And knowledge is power. Midwives play an important role in sharing cCMV information with their expecting moms. But I would add to that advisors of the deaf children, teachers, clinicians, SLTs, audiologists, pediatricians, ENTs, really everyone who's on this call who might have interest also could have a part in sharing information about CMV. So here's Pia's contact information. And this is how we ended our presentation. So I'm sorry Pia couldn't be here today to present that, but I think you'll agree she did a wonderful job. I'm just checking the chat to see if we have any questions or comments. Is there anything, Haruna, that I've missed?
No, I don't think so, Holly. And just to everyone, these sessions are recorded and will be made available to the members of Forum.
All right, and I see a question about sharing Veronica's presentation. And so we'll have to ask Veronica if she's able to do that. And maybe if it's not available now, it might be after you've had a chance to.
Oh, Abraham says, get back to the slide with Holly and Pia's contact. We can provide it later for you.
Very good. I have just one more presentation here just to wrap us up and to share a little bit more. So to make everyone aware, there are some active groups in New Zealand, and we've collaborated with CMV Australia to share the news and the information that we can. There's 2 Facebook groups that are closed groups, but I think they're open to those who have an interest, can be family or professionals. The CMV Australia Facebook is a family support group, and they are quite active, and they've invited the Aotearoa New Zealand group to join them. And then we do have a separate CMV New Zealand group that actually started, I believe, with some of our Hearing House families. So both of these are, you can go online, go to Facebook, and ask to be part of them to help share information and support. June is National CMV Month, and that's a little ways away, but we would really like to take the opportunity of the interest that has grown to make it a more of an event for 2024. So in the document, the Google document that we've shared, if you have any ideas or you want to do something locally, act locally and think globally and about how you can support CMV awareness in the month of June, we'd love to hear about it. And it would be really amazing if we could have some kind of a coordinated effort in New Zealand to recognize CMV awareness and prevention. The groups that we've invited or we've divided into kind of fall into these natural categories of awareness, prevention, screening and early identification, family support and communication, and laboratory and applied research. But certainly those of you who expressed interest in being part of this working group said they wanted information or wanted to be part of all of these aspects. So, you know, while I think we in New Zealand, we don't have a screening program for CMV, but I think there's growing interest in developing that. Our focus for now really can be on awareness and prevention. And so sharing information about CMV and prevention, I think is something that is going to help in the big picture until we can potentially get to a screening or a targeted screening status in New Zealand. Family support and communication, whether it's through media, social media, or events, is always important and helps families feel less isolated and less unique, I think, in when their child is experiencing a multitude of different behaviors. So thanks again to everyone for coming on today. We look forward to hearing your comments and feedback. And if you haven't already signed up on the Google Sheet, please add your email and we'll keep you informed about any upcoming events or meetings. And again, any ideas or discussion that anyone wants to share, we'd really welcome that. So I'm going to stop the screen share here. And, oh, actually not going to stop it. Herbruna, do you want to close us off with this next karakia?
Sure, Holly. Ka whakairia te tapu, kia wātea ai te ara, kia tūru ki whakahata ai, kia tūru ki whakataha ai, hui e tākie. Thank you so much everyone for coming.